Okay, so you all know me, of course. I'm Desiree. I just barely took over the Employee Health Department in August. And since then, I've done some education and learned some new things, and so we've just started changing some things a little bit to be more streamlined for the hospital, to take better care of employees when they get hurt or injured, and then to make things easier on everybody. We actually have less requirements overall, so that you're all within requirements of the hospital. So, let's see. All right, so fit testing is the biggest one. I did some education in Vernal with an OSHA licensed provider that was specific to fit testing and our respiratory protection program and how it applies to the hospital. And we can make it a lot better. So we're starting to make it a lot better. You can check out the policy. The policy has recently been updated to reflect some of the things that OSHA's changed recently. So fit testing was previously a condition of employment. You had to be fit tested before you could work, and that's not the case anymore because that big long questionnaire that everybody answers no down, if you have any medical problems that are on that questionnaire, you actually have to be seen by a doctor. The hospital provides it, and the doctor has to say it's okay before you can put that mask on because it can cause medical problems. So now that we found that out, we're doing it the right way. And so we will get your questionnaire if you are supposed to wear this mask, if you're going to be in direct patient care environments where you could possibly be exposed to some airborne contaminants. We'll get your questionnaire filled out. If there's anything that's concerning, we'll forward it over, and then as soon as we get your clearance from the physician, then we'll move ahead with fit testing you.
So my department would stay the same?
Your department would stay the same. We have moved more towards doing an evaluation of your risk because the only people that need to be fit tested are the people that the hospital would want to wear those masks in that situation. So I think security might, though.
So, is it okay to ask a question?
Yes, please do. That's why I'm here.
Okay. Some time ago, there was a suspicion of TB with a behavior health patient. It was not clarified.
Okay.
But as soon as I heard that, I told staff, hey, we should be using PPE, right?
Yes.
And everybody's going, I don't know, should I? I said, I'm not going in there unless I'm wearing one.
Yep.
But I think there needs to be a trigger to be pulled on when people say, somebody should have to say, hey, don't go in there.
Yep.
Until you're wearing your PPE.
So actually, I only know this because I literally just read the policy yesterday. So in our tuberculosis airborne isolation room policy, it actually specifies that information very clearly. So any confirmed TB or suspected TB is treated as confirmed TB, and then the person that would dictate whether or not you're following isolation precautions is going to be the charge nurse. Pretty much anyone that's taking care of the patient or anyone on the floor, the physician, the nurse, the charge nurse, can institute isolation immediately.
Okay.
And then everyone should be following the policy, and they should be contacting infection control immediately.
He was evaluated and discharged, but I can't recall if they did get 100% confirmation.
Okay.
But it was only brought up because I think he said he suspected he was homeless.
Oh.
You know.
Okay. So I think that so we've also moved in annual review of the charts, which is also in here. But during that review, we're going to do the evaluation of what your risks are. If the hospital would expect you to be directly handling the patient in a situation like that, if they had measles, tuberculosis, something like that, and then we would continue with fit testing. We also have a new machine, which some of you have already seen, but we have a machine that Dr. Mitchell had previously purchased for the clinic. They have 2 of them, and so they were very nice and gracious and let me bring it over here so that I can fit test people here. So it is the preferred method by OSHA. It is to OSHA standards. It takes 7 minutes, which the U.S. government's trying to get that down to 2.5. You do have to be clean shaven though, which is, we were kind of lax on that before, but it won't.
I can do this?
Yep. Any hair that doesn't come into contact with where the mask seals on your face is fine. Totally fine. Any questions about that? So instead of October for fit testing, you will get an email or a phone call during your birth month. So usually probably going to be about the first week to schedule, and you have the whole month. The whole month, as long as I get a hold of you within that month, then you'll be all set.
So if they have to be shaven to do the testing, do they have to be shaven to wear the mask in any situation?
They do. 100% they do. So any facial hair that comes into contact with the mask seal, you could be exposed to whatever you're covering with. So the cool thing about this port count machine that we have is, so instead of relying on your smell and taste, it measures exactly, we fill a room with salt water, and it measures exactly how much salt water is leaking inside your mask. And so the set is at 100. So if more than 100 particles of salt leak into your mask at any time, at any given interval, then you fail the test, or you fail that section, because you'd have 100 particles of whatever you were in the room with, whether it be measles, tuberculosis, and you'd be exposed at that point.
I got a question. What requires us to wear a mask?
So anyone on airborne isolation. So I sent out an email not too long ago, but any virus, bacteria, or even, so virus and bacteria mostly for us, for healthcare, and for you guys, that is transmitted via the airborne route. So flu is only transmitted that way if they're doing procedures like bronchs. So those would be reasons to wear an N95. Measles is one, chickenpox is another. There's some types of meningitis that are tuberculosis. So the ER is going to be the first place where they walk in and say, I think I might have tuberculosis. A lot of people are going to get exposed in the meantime before people know, if they don't know, and then they're diagnosed afterwards. But that's where we come in, we follow you, we treat you, we make sure everything's, you know what I mean, everything is followed up as it needs to be. Other departments, like med-surg, they're already going to know, hopefully, unless it develops while they're here.
So, we had a behavioral health patient that had TB. This was
Long time
just,
ago?
no, 2 years ago, and it
Okay.
spit in my face. And we had to follow up. I only had to report it to, who was it for you?
Patty.
Who?
So it would have been,
Patty, yes.
yeah.
And she goes, what'd you do? And I said, I washed my face and hands after that happened. She goes, okay. There was no follow-up. I mean, I don't know.
So tuberculosis isn't transmitted by droplet, so, or mucous membrane transmission,
Okay.
but it'd be airborne. But if you weren't wearing an N95 and the patient had tuberculosis, then you could have
Maybe that's why there was
contracted
no
it.
follow-up.
So that's another thing that we're gonna start doing is, so with the annual chart reviews, we've noticed a lot of, not fallouts, but things that we haven't been quite so great on for following up. So there's people in the hospital that manipulate tuberculosis samples, there's people that instill BCG into the bladder, which is a form of tuberculosis, and they aren't getting annual TB tests, which the hospital's not required to, but if you have an increased risk, we feel like that's probably a good idea. So we're gonna start instituting that. But so with the fit testing changes, we wanna keep the least amount of people in those rooms as possible. So only the people that are directly related to the patient's care should be going in and out of the rooms. So we have a lower number of people to try and keep track of if there really was an exposure. So that being said, we would prefer students not be in the rooms, but we know that we have students that come in for weeks at a time sometimes, and if they're gonna take care of that patient from start to finish, we'll fit test them and they can go in and take care of that patient. It's gonna be a case-by-case basis if they do have that happen, because overall we would prefer that they not go in airborne isolation rooms. They can still take care of other patients, ones that are on other types of precautions like droplet and standard, obviously. I think I covered everything on this slide. So policies, I just briefly went over it, but all the policies, if you go on policy stat that are under the employee health area, are being updated with updated information and to reflect some of the changes that we've made, like with fit testing, the students and stuff like that. So if you have any questions, check out the policy. If it doesn't reflect your question, please just contact me and I can let you know what we're moving towards, if we have an idea or if it's been done already. Okay, so this doesn't apply to everybody, but so we had found that the schedule for blood work for people that are exposed to bloodborne pathogens or blood and body fluids, so like in your case being spit in the face would constitute, the schedule before was a little bit longer, except for in cases where you don't know who you were exposed to. So if you have an unknown source, you get stuck by a needle that you don't know where it came from, the schedule's kind of the same. It will still follow you out for a year, obviously, to make sure that you don't contract anything. But the first 6 months is a little bit different. The policy has the blood work schedule attached to it if you want to check it out or if you want to know what it is. Or if you ever have an exposure and you're wondering what your schedule looks like, it's on policy stat. And employee health, so me, so I am the home of all of your follow-up testing. So I'm the one that contacts you to make sure that you come in, and I give you your orders for your blood work, tell you what your results are, if you need to be referred to a physician or anything like that. That all lives within employee health. So the flu clinic, the flu clinic and fit testing clinic is no more. Okay, so this will be the first year, 2018, that we are not doing that. So all of your fit tests will be conducted during your birth month if you need to be wearing a mask. And then also we will review your chart during your birth month and see if you're missing anything, you need any boosters, you need any titers, you need any TB tests. We'll do all of that during your appointment. And then we'll do a mobile flu clinic. I will go, and me and helpers will go department to department, whenever it's convenient for each department, and immunize you as we go throughout the month. So that way you don't all have to congregate and try and rush in a day or two. So hopefully that'll help everybody with their flu shots. Okay, so record review. So I'm a little bit behind only because of the changes, and because I don't want to have everyone whose birth month is in January that got fit tested in October have to get fit tested again in January. So you'll just be a month behind, a month or two behind next year, which is okay. But so I'm still going to do the reviews, but people whose birth months are in January and February, you're going to start getting emails now because I'm just reviewing those charts now. But we talked about all of that. Okay, so the wellness challenges. I did send out the newsletter for February on Monday, so if you haven't read it, go ahead and check it out. It has a whole bunch of information about these 2 challenges that we're doing, as well as so we're doing weekly recipes too. I'm sending those out as part of this. But the Western Challenge actually started the end of January. I didn't know about it though. I had no idea that it was even going on. So when I found out about it, I actually reached out to the college to see if they would run through another group of us so that more people could participate if they wanted to. And they said that that was wonderful and that they would do that for us. So it's a 12-week challenge. You go for the pre-testing, which our pre-testing time is tomorrow at 5 at the college. You just go to the atrium at the college. You just need to let me know so that I can give her a head count, because their students do all of this for free, and it's four things that they measure individually. It's all confidential. You can do individual or team. It's $15 per person. 12 weeks, they offer classes. The handout is attached to the newsletter that has the times. I think it's either 5 or 7 on Tuesdays and Thursday afternoons, where they do a free fitness class for anyone who wants to participate. And this is community-wide, so it's not just for the hospital, but we've been invited, and the hospital is helping sponsor it as well. So you participate for the 12 weeks. You don't have to do anything for the 12 weeks. There's no checking in, weigh-ins, anything like that. You follow your own routine of whatever you want, and then on the flyer are the post dates. It's in April. You just show up for one of the 3 post dates, and they'll do your post testing, and then you're entered into the drawing for prizes, which are offered throughout the community. And then the diet bet is all online. It's just hosted within the hospital. There's a link within that newsletter, and if you don't have it or don't see it, I can send it out via email as well. It's $10 to play. You just follow the link. It walks you through how to do it. And essentially, the website does everything for us. You send in your 2 pictures as they want. The game starts on the 9th. The more people that play, the bigger the pot. And then at the end of the 28 days, whoever's met the goal gets entered in to win the pot. And then you'll split it between all the winners. But so the cool thing about Diet Bet is if you win, there's like a no-lose clause in there that you won't lose your money. So if you lose the 4%, even if you didn't have enough people to play, that they'll still give you your bet back, no matter what. And you win cash. Any questions about that one?
Measure inches and weight?
Nope, so it's 4% of the total body weight that you've submitted in your pre-test.
So just weight.
So it's individual, it's all confidential, your weights are not posted on the website. You can see, you can talk to each other, the people that are participating, it tells you who's participating, but everything else within there, your pictures aren't posted in there, I don't believe your weights are posted in there, that's all confidential.
So we used to do that at the hospital every year,
Yeah.
ago.
See,
fun.
we should do it again.
That's
See
cool.
if we are.
Yeah.
Okay, so, we're already doing most of these things, but I've been reaching out to local places. There's a couple of fitness places in town that have offered us discounts within the hospital. It's in the last, not this month's newsletter, but the New Year one, so in January, if you're wondering which ones there are. There's, I think, 2 or 3 that are gonna do them year-round, and then there's 2 or 3 that we're just doing them for the new year. So we'll continue doing quarterly challenges. I'll probably send out another survey here soon. We only had 17 people respond to the last survey, so as to what you guys wanted to see, but we still did what the highest numbers were on there. If you guys like, I've heard lots of good feedback that the recipes, everyone likes the recipes that are going out, so I'll keep doing that. And then if you guys have ideas for like wellness, overall like wellness ideas for the hospital or things you'd like to see, like just let me know and I can start working on them. And I think that's it. Any questions? Okay. Thank you.
Yeah, years ago when we did the challenge, it was fun.
Well, I was having a hard
It
time
always
with
started
how to...
January 1st, and I think